Hello, we're going to present the management of combined tractional and rhegmatogenous retinal detachment due to diabetes mellitus. First of all, we have no financial disclosures to report. And let's start with our patient. It's a 42-year-old woman with bilateral visual acuity decreasement, the type 2 diabetes mellitus. She had counting figures and 1 out of 10 best corrected visual acuity in her right and left eye respectively, and fundoscopically we can see the image is a combined traction and a rhegmatogenous retinal detachment, actually in both eyes, and this is the OCT image you can see right here. So how do we deal with a patient like this? First of all, you have to take into account that both eyes need therapy, so we decide to begin with the left eye due to its better visual perspective postoperatively, and then continue with the right eye 1 month later. The time of the second surgery is co-decided from us and the patient. Also, we decided to perform an anti-VEGF injection 1 week before each surgery in order to make those retinal membranes and neovessels shrink and make the surgical field a little bit better for us. Here's the surgical plan, and let's begin with the surgery video. First of all, we perform vitrectomy. In the one hand we have the vitrector, and in the other hand we have the chandelier light. As you can already see, there are too many membranes and we have to remove all of them in order to release the retina. Now, for that reason, here we use the forceps in the one hand, so to pull those tractional membranes, and in the other hand we have the vitrector that actually acts like a scissors, so to cut them apart. What we can see here is that those tractional membranes, they are like bridges that they connect the one side of the retina with the other, and sometimes they are too powerful to cut them, so we have to be very patient and very persistent. On the other hand, we have to deal with those neovessels that they are actually everywhere, and every time we try to cut those membranes, they are bleeding, and those hemorrhages make our procedure even more demanding. We continue pulling with the forceps and putting this vitrector underneath in order to cut those membranes apart. Now, sometimes when removing those membranes, many retinal tears are revealed underneath, and we also have to deal with them. We have to sear them with endolaser until the end of the surgery. Here we perform a shaving of the vitreous base, as you can see here, and even that side of the vitreous cavity there are neovessels, and we remove some of them with the vitreous. Here is a quite big blood clot that we had to remove, and also remove all the residual hemorrhages inside the vitreous cavity. Here we perform a panretinal photocoagulation with endolaser, and at the same time we seal any retinal tear like this one, and in the end what we do is filling the vitreous cavity with silicone oil. Here is the postoperative OCT images, and this is a summary of our presentation. Thank you very much for your attention.